Hi, welcome and thank you for joining the Women in PrEP webinar. My name is Ivory Howard and I'm a program manager at UCHAPS, and I'm so excited to be able to bring more information to you about women in PrEP. We can't overlook the importance of PrEP for women. It's an incredible tool that women can use to take control of their sexual health, and it empowers women to take control of their sexual health in the same way they take control of their family planning with the birth control pill. And today's speakers will share more about their work with women in PrEP. That includes outreach, marketing, treatment, and research, as well as the future of women in PrEP. So today we will begin our discussion with Rashaunna Reed, a nurse practitioner from the Baltimore City Health Department. All right. Rashaunna, your line is open. You can begin. Rashaunna, can you hear me?
I sure can. Can you hear me?
Yes, I can hear you.
Awesome. Hi, everybody. I am Rashaunna Reed. Thank you so much, Ivy, for the introduction. I am a nurse practitioner with the Baltimore City Health Department, and I work specifically in the STD clinics as well as the PrEP program. And so I provide services for both clinics, STD as well as PrEP. And today I'm going to discuss with you a little bit about how our PrEP clinic runs and the women that we see in our program. Next slide, please. Okay, so we offer what we call full PrEP services here, meaning that we offer testing and screening, as well as medication and follow-up visits. And so here at the Baltimore City Health Department, we can see someone for a specific visit just pertaining to PrEP, or we could also see patients for STD visits, and then they are referred into the PrEP program. And it's a really good opportunity to discuss PrEP with patients who may not be aware of its existence or may not have that much information about it. If they come in for an STD visit just for screening, then we can discuss PrEP and PrEP's benefits. We also are able to enroll patients into medical insurance who may not have insurance at the time of their visit. So it's a great opportunity to get someone insured who was uninsured prior to coming into our clinic for the purposes of PrEP, yes, but of course they can use their health insurance for other services. We discuss patient assistance programs with the patients as well, because we do not deny patients PrEP on their inability to pay. The manufacturer of PrEP has a great patient assistance program for those who might not be eligible for health insurance, or for those who may be insured but have a significant copay that's attached to the medication cost. So virtually, our PrEP patients pay little to nothing out of pocket. With our PrEP services, we have a case manager on site, so we offer psychosocial services. If anyone needs a referral to addiction services or housing services, we understand the hierarchy of needs. And so if someone has an issue with housing and they don't know where they're going to sleep tonight or the next night, PrEP is kind of lower on the list of priorities. And so with that, we try to get them linked up into services that suit their immediate needs. And then from there, we can go on and discuss PrEP and get them enrolled into PrEP if they so choose. Our PrEP program, we participate in community events, and we also participate in outreach, and we have a full team. Next slide, please. So with that full team, someone who is obtaining PrEP, like I said, would come in virtually seeking PrEP upon their initial visit, or maybe here for an STD screening. They may have symptoms, may not have symptoms, but they would meet with our whole staff. They would meet with our peer navigators, our case manager, our nurse, myself as a provider, and PrEP labs would be added to their standard STD visit if they opt into full testing, and we encourage full testing, full screening for some of the most common sexually transmitted infections. At that time, we discuss patient assistance programs for those who are uninsured or for those who may have a copay involved so that they don't have to worry about the cost, because that can be a barrier. So we try to eliminate as many barriers as possible here. And we go into full detail about the medication itself, some of the side effects, some of the concerns or worries that patients may have that may also be a barrier to them starting PrEP or staying on PrEP. And so those discussions are conducted by myself as a provider or our PrEP RN. At that time, labs permitting, a patient can be given a 1-month prescription when they first start, and then we bring them back in and discuss how they're doing. So we keep constant contact with our patients here. We don't try to be overbearing, and so for their subsequent visits, we see them every 3 months, again, labs permitting, provided that all of their labs are normal and it seems like their body is adjusting well to the medication. Also, adherence permitting. If the patient seems like they're doing well with taking the regimen and following the regimen, meaning taking the 1 pill once a day, once we see that they're doing okay with that, then we see them every 3 months. But we try not to space out their visits that long because we like to maintain contact. And again, just seeing the patient every 3 months. We repeat labs, we discuss medication, we always talk about adherence and the risk as well as other needs. So we're always trying to check in with our patients and stay tuned into what they need and not just stay on the superficial level of discussing PrEP. We see PrEP as a part of their whole lifestyle, and so we like to address many of the other issues that they might be facing. Next slide, please. So specifically women and PrEP here at the Baltimore City Health Department, we currently have over 100 patients that are active with us. Over the past couple of years, we've had definitely more than that. We've had some patients transition out of the program because maybe their health insurance changed. They might have gone to a Kaiser health insurance where they may have to see a Kaiser provider, or some have moved out of the state or out of the country. And in that case, we like to do what we call a warm handoff, where we link them up with a PrEP provider in their area along with all of their past labs and things like that, so that they don't fall out of the PrEP program, or they don't fall out of the PrEP regimen rather. But for the most part, most of our patients have been predominantly male, and I think many PrEP programs throughout the country can say the same. Ours are no different. We have predominantly African American men who have sex with men in our program. But I will say there are about a quarter of our patients that are women, and predominantly African American women. Just kind of looking at our stats, most have been above the age of 25. And women join the PrEP program for many different reasons. So we have women in our program who are part of serodiscordant relationships, meaning they are negative, but their partners are HIV positive. And again, in order for them to take control of their sexual health, we talk about the benefits of PrEP for them, whether their partner is on antiviral medication or not, whether their partner is undetectable or not, because we all know that the risk is pretty low if their partner is undetectable and following an antiviral regimen well. However, for the women to be able to take control of their sexual health, we discuss PrEP. We've also had a patient, a part of our program, that is in a serodiscordant relationship, but used PrEP for the purposes of conceiving a child. And so she is engaged in a serodiscordant relationship with her partner, and her partner is on antiviral medicine, and her partner is undetectable. So perfect scenario, but for the benefit of her, so that she could have control throughout this process, since in order to conceive, she would not be able to follow a strict condom use regimen as they were doing. She used PrEP for the purposes of conception. And so that's an option that we offer here at the Baltimore City Health Department. And then once a patient conceives, then we discuss the benefits/risks of her staying on PrEP while being pregnant. In particular, in this case, just discussing it with the patient, she decided to come off of PrEP once she conceived and then go back to using condoms strictly. But that's an option that we have here to offer PrEP to women in those situations. We also have women on PrEP who are commercial sex workers, or women who are in non-monogamous partnerships, whether it's a mutually non-monogamous partnership or whether their partner is practicing non-monogamy, if that's a word. And we also have patients who are in addiction treatment programs. And so they add PrEP as a form, as a layer of protection to their normal, everyday level of protection as far as using condoms. So the women in our program come from all walks of life, many different age groups. Although predominantly African American, we see a lot of different ethnicities in our program, and definitely trying to broaden them. Next slide, please. So right now, we're trying to increase PrEP awareness here in Baltimore City. A lot of the advertisement has been geared towards men, particularly men who have sex with men. And so here at the Baltimore City Health Department, yes, we definitely want people in that community to be aware of PrEP and to understand PrEP's benefits and spread the word about it. However, we also want to make sure that women are aware that PrEP exists and that it can also be a benefit to them. And so by doing that, that's where our outreach comes into play. That's where our community services and our participation in community events come into play. Particularly, we try to formulate partnerships throughout the community. There's one group that I'm thinking of, community organization. They are GLCCB, the Gay, Lesbian, Bisexual, and Transgender Community Center of Baltimore in Central Maryland. And since the beginning of this year, we here at the Baltimore City Health Department, our PrEP team has gone out about every other month, late at night, trying to spread the word about PrEP with commercial sex workers within the Baltimore City area. This weekend, we're going to be at a ball called Know Your Status Ball, where we're just letting people in the community know about our program and about the benefits of PrEP in general. So that's where we are now, just trying to increase the word amongst women here in Baltimore City. I think that's pretty much it for what I have to say right now. I know we'll have questions at the end.
Yes, thank you, Rashaunna. Okay, I'll pull up the next presentation. Just give me 1 second. Okay. Our next speaker is Susan Alvarado from APLA Health. Susan, your line is open.
Thank you. Can you hear me?
Yes, I can hear you.
Okay, wonderful. So good morning to everybody, or more so good afternoon, because I know most of the people might be from the East Coast listening into this webinar. I just want to start off by saying thank you to Ivory and UCHAPS for hosting this webinar. It's really crucial to have these conversations about women in PrEP, and hopefully the information that I provide today will be very useful to those folks that are specifically working around PrEP and how to target women. Next slide. So just to briefly go over what I will be speaking on today, I will just briefly touch on some clinical trials that have included cisgender women. I will get into the aegis study, which is a study happening here at APLA Health. PrEP navigation for women, some preliminary findings from this study happening at APLA Health, marketing and campaigns, the needs for women, and finally just to share some of the more common testaments from our women from the study. Next slide. So these next couple of slides here were put together by a colleague from UCLA, and it really just simplifies the understanding of what studies around cisgender women have looked like in the past. And the data that we currently have for the effectiveness of daily oral PrEP in these clinical trials in heterosexual women or cisgender women has been conflicting. The more prominent studies are the ones that you see here, which is Partners PrEP and TDF2, which included both men and women. Then there were studies that just included women, and those were FemPrep and Voice. Something about these studies is that they did not happen here in the U.S. and they happened outside of the U.S. So all of them were conducted in Africa, in different countries of Africa. With Partners PrEP and TDF2, which included both men and women, when they looked at just the data for women alone in taking daily oral PrEP, they found about 66% effectiveness in Partners PrEP and 49% effectiveness in TDF2 when it came to adherence levels among women. FemPrep and Voice, unfortunately, both studies were stopped prematurely because they couldn't confirm efficacy. With FemPrep, they found that the women were reporting adherence to Truvada at 95%, yet when they looked at their blood levels, it suggested that their adherence was actually between 15 to 38% effective. Next slide. And here, when looking at the studies or the clinical trials in women alone, you see that FemPrep was conducted in Kenya, South Africa, Tanzania. They had over 2,000 women participate in that. And in FemPrep, they were only doing the tablet. So they were doing Truvada. Again, the efficacy was very low at about 6%. With Voice, that study was conducted in Uganda, South Africa, and Zimbabwe. That one had a much larger sample size of over 5,000 women. And in the Voice clinical trial, they used not only the tablet, so the Truvada, but they were also using a vaginal gel as well. But this one had even less significant findings at negative 4.4% when it came to adherence in our women. So again, the couple of studies that have been conducted around women and PrEP not only have been international, they've been stopped prematurely because they couldn't report any efficacy with the medication, which doesn't necessarily mean that the medication was not working. It's just that what the researchers have come to find out is that there were definitely challenges to adhering to the medication, specifically with women. Next slide. So again, clinical studies with women specifically, cisgender women, are very limited. The few that we do have were studies conducted in Africa. There are inadequate PrEP adherence information there. What's even more, well, I guess it's not really shocking, but it is surprising to see that here in the US, we have very limited data on PrEP use in women. So we don't have too much data that exists here in the US. And I know there are studies being conducted, but not too many. And then more research is needed to understand the effective implementation around women in PrEP, not so much as to if the medication works or not, because we know it is effective when adherent to it, but really understanding how to implement it effectively around women. Next slide. So just to touch a little bit about the aegis study that is happening here at APLA Health, and we are just one of 5 sites in Southern California. This is a study that is being funded by the California HIV Research Program. Funding came back in 2015, but we launched as of last year, 2016. It is a demonstration project for women in Southern California. So we have sites in LA County and San Diego County, being that LA and San Diego County have some of the highest rates of HIV. So that's why these 2 counties were selected. For this study, we are recruiting 135 participants, so it's broken down between the 5 sites. Here at APLA Health, we recruited 50 participants, which we just closed enrollment as of a couple of weeks ago. And of course, the focus of our target population is among African American women and Latina women. Next slide. And so a little bit more about this study and what exactly we're doing. What are the interventions? Well, we're taking an approach of a multimodal intervention. And what that means is that we're using technology. We're using text messaging. So we set up a text messaging system for our participants, and they get daily reminders about taking their medication. So they have to be interactive with these text messaging. So they'll get something like, hey, did you take your PrEP today? And they have to respond by saying yes or no. So it has to be interactive on the part of the participant. So these are being sent daily, and so far, what we've heard from our women is that they find this tool very helpful as a way to remind them to take the medication. We're also doing therapeutic drug monitoring. So what that means is once women start on the medication, they are being monitored as to see how much of the Truvada is in their system. So every time they come in, we collect blood samples, and they get shipped out to a laboratory in Colorado where they look at the levels of medication in their system, and we can tell if they're being protected or not against HIV. And we have a threshold where they need to be meeting. So that's been established by the researchers. And then on top of that, we also do behavioral counseling. So for instance, for our women, once we get the results for their medication in their system, we can provide feedback to them as to, hey, your levels came back low. Is there anything happening? What can we work on to be able to support you better in your adherence to the medication? So we do, with the behavioral counseling, focus on sex behaviors as well as adherence behaviors. The duration of this study is 48 weeks, and within that 48-week period, women are scheduled 7 times. So initially they have a screening visit, then they'll come back 2 weeks later for their enrollment visit, which they get their first prescription of Truvada. And then we also compensate for their time for this study, and we provide transportation as well, as we've seen that transportation has been a barrier for a lot of the women to make it to their appointments. So we've made sure to include that in this project. And if you can see to your right there, this brochure here, Own It, PrEP for Sex, is one of the brochures that we've been able to distribute to the community for women to become more aware of PrEP. But this brochure specifically really talks about women in PrEP and being on this project. So it's not really general. So now that we've completed enrollment here at APLA Health, we have to pull these materials, unfortunately, because they're really geared towards folks who are trying to get on the study. Next slide, please. And just to talk a little bit about some of my roles here as a study coordinator for this PrEP study at APLA Health, one of the things is that when I came on board, I thought, okay, well, I'm going to be the study coordinator, really just focusing on this study and just trying to get women in and meet the sample size that we need. But I have found throughout my time working on this study is that I'm wearing multiple hats, and I'm seeing myself more now as a PrEP navigator for women, because throughout my time, I've done a lot of outreach events in order to recruit women, not just part of this study, but just really to raise awareness to women about PrEP and getting access to PrEP. So if women were not interested in being part of this study, we do have a PrEP program here at APLA where I could refer them to. And it's really to spread the word about PrEP around these communities where most of the women don't know this is an option for them. So really getting out there, recruiting women to get on PrEP and to provide that option through different outreach events. Collaborating has been a key component to the success of my outreach efforts, collaborating with providers and community leaders. I've done a lot of collaboration with community gatekeepers, community leaders that have direct contact with those women that could benefit from PrEP. Also provider education. In this time that, in this time in my role as a PrEP coordinator for this study, I've done a lot of trainings with different agencies around women in PrEP, because it's surprising to see how many people still are not aware of PrEP. They're not aware how it works, and more so, they're not even aware that it's an option for women. And these are providers, some that work in the field of HIV and some outside of the field. And then again, building partnerships, especially partnerships with those providers, stakeholders that work directly with women are very important, and that helps to provide a referral network. And also building rapport with women. I don't actually take an approach that, hey, I interact with women and okay, let's get you in this study, let's sign you up. No, it's really just meeting the women where they're at, and that is so important because again, women have very complex lives and they have a lot going on, and sometimes there are other priorities over their own health, over maybe getting on medication to prevent HIV. So really just building that rapport and meeting women where they're at goes a long way. Next slide. Okay, and just to share some of the preliminary findings for the study here at APLA Health. I can't speak for the other sites because some of the other sites are still ongoing with their recruitment, but just to share a little bit about what we've been seeing, or what we've seen so far here at APLA Health. Our sample size here, I'm not sure if I had already mentioned this, we had to recruit 50 women, and what we found so far is that the primary ethnic groups that were enrolled in the study were 46% Black African American women and 32% Latino women. In terms of the demographics, we had over 50% of our participants that were 40 years of age, 40 years or older. Our youngest participant was or is 18 years old, and our eldest participant who just completed the study was 65 years old. And almost 50% of our participants started off in a serodiscordant relationship. Some of these participants have, since being on the study, have broken off their relationship for different reasons. Next slide. And just some other preliminary findings in terms of the interest that was seen on this study from women. From June 2016, when we started our outreach efforts to promote this study, to November, we scheduled 80 women for a screening visit. 50 women were actually enrolled in the study, and we had over 100 women inquire about PrEP and the study. Next slide. And just to talk a little bit about the marketing and campaigns happening in LA County. Unfortunately, as of right now, we don't have any campaigns in LA County that target women in PrEP. As I mentioned earlier, we did have the study materials that the aegis study provided in terms of women getting more information on PrEP. But now that the study has closed in terms of enrollment here at APLA Health, we can't provide those brochures anymore. So there really isn't anything out here right now that really speaks to women when it comes to these marketing and campaign ads. We have established a women's PrEP network here in LA County. It's a group of us, of different providers from different organizations that came together to really address the needs of women here in LA County around PrEP. So what happened, we came together and we conducted 5 focus groups across LA County. What we were really, the main purpose to do for this was that we were really trying to gather information about a future campaign for women and PrEP. So through these 5 focus groups, we had conversations about 2 to 3 hours with women in the community and really getting an understanding of what they would like to see in a campaign for women and PrEP. And across the board, many women, when we brought these focus groups together, they didn't know about PrEP. And the few that did know about it, they thought it was for gay men, as they put it. Next slide. And so, again, the consensus of these 5 focus groups was that the women believed that PrEP was for gay men. They had no idea that PrEP was an option for prevention of HIV. And then there was also a very, very strong consensus around the current campaign that's happening in LA County that has been launched, I think, more than a year now by the Department of HIV and STDs program. And if you can see the image there, it's called The Protectors. And it is a cartoon that really talks about PrEP and really raising awareness. But across the 5 groups, women felt that this campaign did not speak to them. They had no idea this had to do anything with PrEP. They've seen this campaign on bus stops, on buses, but they never knew it had anything to do with PrEP. So just the fact that we hear from women from the community that, hey, this campaign may be out there promoting PrEP, but it doesn't speak to us. It has nothing to do with us, and we want to see something different. So we were able to gather that information in the hopes that next year we'll be able to launch a first campaign around women and PrEP in LA County. Next slide. So some of the needs for women that I've seen here in LA County, and really from my time working on this study, is that here for the aegis study, we do have set up a referral network for those women that are participating in the study and need pregnancy referral, fertility referrals, especially those women that are in serodiscordant relationships and are trying to become pregnant. So we do have a referral set up for an HIV specialist that works with women, specifically with women in serodiscordant relationships or HIV positive women as well. So we do have somebody in place for that if we need to refer out, which we've done a couple of referrals. We also have a referral network for interpersonal violence services for those women that trigger the when taking. As part of the study, they have to take an online survey. So if they trigger referrals based on how they answer their questions, which the questions, I don't get to see how they answer. I just go to the end of the survey, and a page will come up, and it'll show if women triggered any referral. So I'm able to see that, hey, this participant triggered an interpersonal violence referral, so then we provide those services to them where they can access. And the way it's approached is, I usually will tell the women, hey, based on how you answered your questions, you might find these services that are helpful, and then I give them a list, but I don't tell them, hey, you triggered interpersonal violence referrals here, you might want to check that out. We try to keep it general. And then we also have substance use referrals as well. So we do have a few places where we can refer women out. But one thing we don't have through this project, and that is very much needed here at this site, and I've heard also through word of mouth that it's all across LA County, is that these women need housing. There's a good number of the women that come through this project that are in desperate need of housing, mental health services as well, family planning, and even medical services. And medical services, that includes primary care, women that are trying to get their mammogram, they're trying to get pap smears, and it's been years and years since they've last accessed those services because they don't have insurance. So we don't have anything in place for that through the project, but fortunately, working here at APLA Health, we do have enrollment specialists on site where they can help women get on an insurance plan. We don't have case managers, or we don't have case management anymore at APLA Health, but we usually start off there, especially for the women that might need primary medical services and mental health services. Next slide. Also, other needs for women, and I know this to be true, not just here in LA, but across the US, PrEP education needs to be specific to women. It's been great that we've been seeing a lot of PrEP education already that really focuses on MSM, because we know that is a group that is highly impacted by HIV, but we also got to remember to cater to our women and really have education that focuses on women around PrEP and HIV prevention. Also to provide training to address PrEP for women, provider training specifically, because again, there are providers out there that are being very judgmental about women accessing PrEP or asking about PrEP, and they're clueless. They don't know how to have these conversations with their women. So really just providing training to these providers will be good. And even those folks that are working in the field of HIV, I have come across PrEP navigators who have told me themselves firsthand that they don't know how to have conversations with women around PrEP. So really making sure that providers, even those that work in the field, are able to have conversations with women around PrEP. And also those that, like medical assistants, HIV counselors, that they have conversations with women when they come in to test for HIV and STDs. And again, promoting PrEP for women through campaigns, brochures, ads, and even having dialogue will be very crucial to raising that awareness and meeting those needs for women to provide those options when it comes to HIV prevention tools. Next slide. And lastly, I just want to share with you all some of the testaments from women that have been pretty impactful. I have so many more, but I just thought I'd share a few, just so you can see what is being told by some of these participants coming through my projects. Some of these testaments happened before coming on the project. Some of them happened after they completed the project. So first one being that I had one participant tell me that she said, my doctor won't prescribe me PrEP because he believes I am putting myself at high risk for choosing to be with an HIV positive partner. Another participant said, I was told by my doctor that I will get HIV if I continue with my HIV positive partner. Another participant said that she talked to the nurse at her doctor's clinic, and the nurse said, what is that? I don't feel comfortable prescribing PrEP to you. So I guess this was a nurse practitioner. I had another participant tell me that I guess her lawyer asked her, are you HIV positive? Why would you take that medication? Another participant said she had to drive for almost 2 hours to get PrEP because no one in her area provides it. This is somebody coming from another county outside of LA. And then This was the most recent testament from a participant. She said that she spent almost 30 minutes explaining PrEP to her provider, and at the end, the provider asked her, "But are you HIV positive?" So again, these are just some testaments as to some of the women and their struggles in having these conversations with their doctors, with their providers at their clinics, and with other folks. And for the most part, many of these women try and want to stay private because of these reasons, because of feeling judged, feeling discriminated because they're accessing PrEP. Next slide. So that is it for me. I know it's a lot of information, but just wanted to give a glimpse of the work that I'm doing here at APLA Health as a study coordinator, as a PrEP navigator for women. If I guess now we'll have time for questions, but my information is on the next slide. Next slide. And you can always reach me at salvarado@apla.org or my direct number at 323-329-9024 if you have more questions. Thank you.
Thank you, Susan. And also thank you to Rashaunna. Before I open up the lines, I just wanted to ask a question that we had come in a bit earlier. Are there any resources that you'd recommend for providers to provide better service to their clients? Are there any educational materials that you guys can think of for providers related to PrEP?
I do. I actually, one of my favorite go-to resources is hiveonline.org. So that's HIVE online.org. They are based out of San Francisco, and the director there is Shannon Weber. She's done a lot of work around women in PrEP, and they have just an array of links and information that providers as well as patients can access directly that have to do with women in PrEP, and also men in PrEP, the transgender community in PrEP, and that's one site that I would recommend. And there's a lot of information there that can be downloaded, information that can be printed for providers to be able to have more education and more resources.
For me, I found that the CDC websites have a lot of tools that kind of just start off with some general information, and then they also have these tools that providers can use, but patients can use as well. Some women can use it, especially if they're not specifically coming for PrEP services, but you're trying to engage them in that conversation. It's a way for women to be able to see what kind of risk they may have for HIV transmission. So one of the sites that we've used is called the CDC HIV Risk Tool. And it's a really nice tool that you can use. It's an online system, and you put in the HIV status of the person that's sitting in front of you, which is like one of your patients who might be a woman, and then the second person that they might be in contact with. So whether they're in a serodiscordant relationship or in a non-monogamous relationship, and it just gives them an idea of the possible risk that might be involved in their particular situation. Because you have some patients that are specifically looking for PrEP, they may already know about PrEP, or they may know that they're engaging in activity that might be a little risky, but then you have others that aren't really in the mindset of being aware that PrEP exists or even what their risks are. So I found that to be helpful, and that's on the cdc.gov /HIV risk.
Okay, great. And just one more from previous in the queue. From your work, we touched on it a little bit, but if you could tell us kind of the main thing you feel, or one of your top priorities, things that need to be addressed to raise awareness about PrEP among women? There, go ahead.
So from my line of work, now repeat the question. You said, what are the main
Right. What are
Can you repeat it for me?
from your work, what do you feel is a priority or one of the top things that need to be addressed in order to raise awareness about PrEP among women?
I think we have to start, as providers, start having the conversation about sexual health in general and normalizing the conversation. We had a lot of discussion about just engaging women in conversation about their sexual health during regular, general, either GYN or primary care provider visits, discussing testing, discussing safer sex. Those conversations aren't really happening in a lot of providers' facilities. And I think that's step number one, is just starting the conversation. PrEP will definitely be a part of that conversation. But I think once you engage women in conversations about STD testing, about safer sex practices, condom use, dental dam use, things like that, I think that is like the first start to engaging women in the conversation about PrEP.
Mm-hmm. I agree with Rashaunna too, because starting conversations is so essential, because again, depending on the organization, there might not be funding to just launch a campaign to raise awareness or provide the education. There might not be somebody that can do that all the time. So just starting those conversations, especially women that are coming through to get tested for HIV, they're doing their STD testing. Hey, let's just bring in the topic of PrEP. And I know that that's not happening a lot of sites here in LA, and I know it's not always happening here at the clinic where I work at. The testers are not always having those conversations, and we see a number of women coming through to get tested for HIV, but those conversations are not happening. Again, maybe it could be because the testers are not comfortable with the topic, or they need more training on it, but that is something that definitely needs to be addressed. But conversations is essential just to start off and raise that awareness. We can start off there.
Okay, fantastic. I'll open the lines. If you have a question, feel free to ask Rashaunna or Susan. Okay. I will pause here just in case anyone else may have a question. All right, if there are no other questions, we'll close here. I'm sure you'll receive emails after the presentation, but if there are no questions, no problem. After the webinar, we'll upload this presentation to our website, so it'll be available there later if you'd like to share it with your colleagues or take another look at it. Feel free. Okay, so before we end today's presentation, I did want to thank Rashaunna and Susan for sharing their work with us. I appreciate it very much. And that's it. Thank you, guys.
Thank you, Ivory.
Thank you, everyone.